Hi, everyone. My name is Kelly Chapman. I am the Senior Program Coordinator at the Southeast Mental Health Technology Transfer Center School Mental Health Initiative. We're so glad to have you today for part 2 in our series on Medicaid policy and school mental health. As you are joining, we invite you to introduce yourself in the chat. Let us know your name, your role, where you're joining us from. And if you have any technical difficulties during if you have any technical difficulties during the presentation, we ask that you let us know in the chat and we will be able to assist you. Also, if there are any resources that you would like to share during the presentation, we invite you to put those in the chat as well. During the course of our presentation, we will share a brief survey. It's required by our funder and allows us to continue to do our work. So we ask that you take a few moments to complete that survey. It has 2 parts, and I would like to highlight that when you are done completing it, you will have access to a certificate of attendance for today's session if that's something that you need. Before we get started, a brief disclaimer. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. Today's session is brought to you by the Southeast Mental Health Technology Transfer Center School Mental Health Initiative. We are located in Atlanta, Georgia at Emory University Rollins School of Public Health. We are proud to serve the 8 states in HHS Region 4, which you can see on this slide here. Our center includes faculty and staff with expertise in public health programs, finance, policy, and health systems, which provides us with a unique lens we use to address the mental health priorities in our region. The goal of our center is to accelerate the adoption of evidence-based mental health programs and practices by providing training and technical assistance to Region 4. And now I am very happy to introduce our presenter for today, Dr. Adam Wilk. Dr. Wilk is a health economist and a health policy researcher at Emory University's Rollins School of Public Health and the Health Policy and Management Department. He has 17 years of experience in Medicaid consulting, technical assistance, and research. Dr. Wilk's research focuses on access to care for low-income and underserved populations, especially those with chronic illnesses, and state financing and policy related to providers' operations and care. And now I'm going to turn it over to Dr. Wilk.
Thank you so much, Kelly, and welcome, everyone. Really pleased to be speaking with you all today. In this, our second part of our Medicaid and school mental health financing webinar series this fall. All right, so here's what we have on tap for today. I'm going to start by walking through our learning objectives, and then most of our discussion today will be spent talking about 2 of the 4 Medicaid billing requirements that we are talking about in this series, one related to the provider, one related to the setting where services are rendered. We'll spend a little bit of time talking about different types of reforms, opportunities to change these requirements and how they work in your state before diving into Q&A and then wrapping things up today. So our learning objectives, I'm hopeful by the end of the hour today, you'll be able to characterize all 4 of the requirements that must be met for billing Medicaid for school mental health services, including the 2 that we'll be focusing most of our attention on today, and that's our second learning objective. I'm hopeful you'll be able to discuss the Medicaid policies that can affect which providers can bill Medicaid for services, and whether services provided at schools can be billed to Medicaid. Finally, I'm hopeful you'll be able to describe how state Medicaid policies on eligible providers and covered settings can be reformed in support of school mental health. There'll be plenty of time to talk about each of these. So this 2-part webinar series covers some similar content to a webinar event that we held back in May of this year. I believe the link to that webinar is being entered into the chat. If you're interested in another iteration of this content, this 2-part webinar series is intended to present similar content, but at a slower pace in greater depth and with some greater emphasis on contemporary policy developments in this area, as well as reform opportunities. But if you're looking for something a little bit quicker to refresh your memory on everything we covered in the two-part series, that May webinar may be the perfect resource for you. So please go check out the slides there, the recording. They're all free, just like all of the resources we put together here at the Southeast MHTTC School Mental Health Initiative. And so please click that link in the chat. All right. So before we kick it off here, I want to invite you all to share with us a little bit of information about your level of experience working with Medicaid to pay for school mental health services. So we're going to pull up a Zoom poll here, and I would ask you to select the answer that best reflects your level of experience working with school mental health services and paying for them through Medicaid. Got a wide range of opportunities here. We also asked a similar question of participants in our part 1 of this webinar series and found that most folks did not have any experience or had very little experience working with Medicaid in this context. And so want to make sure we are also speaking to the same kind of audience here today, or is this a more experienced audience? All right. Kelly and Josie, my compatriots, when we've gotten a substantial number of respondents, please shut down the poll so we can see what we've got. Okay. So this is even a more skewed distribution than we had in part 1. We got 2/3 of folks here today who claim no experience working with Medicaid to pay for school mental health services. And then some distribution among the other answers. Well, welcome all of you. And for those with no experience, no sweat. If you did not get a chance to attend our part 1 webinar series back in early November, that webinar event covered the first 2 of the 4 requirements for Medicaid, for billing Medicaid for school mental health services. Today, we're covering the 3rd and 4th. And I'm hopeful that between those 2, you'll be equipped with a lot of information you'll need in order to get off the ground in billing Medicaid for school mental health services in your district. All right. One other resource I want to point to before we jump into the content today, and that is the Medicaid and School Mental Health Services FAQs report. So this is the soup to nuts report that we prepared and published last year, covering everything you might need to know about what Medicaid is and how it can work in the context of school mental health services. We cover a lot of different topics. It's a fairly lengthy report, but written at a very consumable level and broken up into sections so you can take what pieces you need at different times. And we hope it's very useful to you. It's been among our most downloaded resources here at the MHTTC. And so I read that to suggest that lots of people have found it useful. If you haven't accessed it yet, please click the link in the chat, download the resource, circulate it widely. We'd like to see this report used as much as possible. I will be referring back to some content specifically from this report later on in this talk too. So even I find it useful. All right, so let's dig in. The 4 requirements for seeking Medicaid reimbursement for school mental health services are listed on this slide. The first one, Medicaid has to cover the service. If the service is on the list of Medicaid covered services, you're good. Otherwise, you may not be able to seek reimbursement for it. On the recipient side, the student or client has to be enrolled in Medicaid. Third, the provider has to be a Medicaid certified provider. And finally, the setting where the service is provided. In some states, the school is not a Medicaid accepted setting, and in other states it is. The school must be a Medicaid accepted setting in your state in order to bill for school mental health services. Those are the 4 requirements. We talked about the first 2 of those in the part 1 of our 2-part webinar series, the service and the recipient related requirements. We may be entering into the chat now a link to the part 1 webinar series, if part 1 of this webinar series, if you're interested in going back and refreshing your memory about that content or seeing it for the first time. And then the 3rd and 4th requirements related to the provider and the setting, those will be our focus today. So again, for each requirement, key terms vary by state. That's why we're walking through all of these requirements in some depth over the course of this webinar series. But today, we're going to be focusing on the third and fourth, the provider and the setting. So let's dig into the provider first. So the third requirement, again, is that the provider delivering the service must be a Medicaid certified provider in order for you to receive Medicaid reimbursement for that service. So what does that mean? Well, in most states, it means that the provider must meet the state's licensure or certification requirements, whatever is required for their profession. And then they must also complete an application, which must be approved by the state, of course. Now, that application tends to not be super complicated, but there are still many providers who have not completed it or received approval for their application yet. And so that is the barrier to a provider becoming Medicaid certified. Now, for LEAs in the audience, if you plan to seek Medicaid reimbursement, it will be important for you to check if your employed providers or partners are Medicaid certified. You may not have easy access to information about their Medicaid certification status yourself, but the providers should have that information pretty handy. So it's a fairly straightforward question to ask. For those providers in the audience, I trust you probably know if you are Medicaid certified or not. And so you may be tuning in more for information about the school setting. I promise we'll get to that. Okay, so the rules about Medicaid certification of providers do vary by state. In particular, different states have different lists of types of providers that may be eligible to become Medicaid certified. So for example, in some states, school nurses or peer counselors may be Medicaid eligible. They may be eligible to become Medicaid certified. And in other states, they may not. We're aware of some states that have pursued or are pursuing changes along those very lines, and we'll be coming to some examples like that in a little while. Though, unfortunately, there aren't any national data repositories that show where all states are on this spectrum, and so I don't have that kind of resource to share with you, but that kind of information can be available through state Medicaid websites. So if you go to your state's Medicaid website, there's usually a section focusing on providers. And within that section, there may be a page where the terms of certification or provider eligibility are listed. And there will probably also be a link for providers to seek certification, to the form and information about how to complete it and submit it. The fine print, though, is that this may not be sufficient for a given provider to seek reimbursement in states where Medicaid benefits are administered through private Medicaid managed care plans. These are privately owned commercial plans that contract with the state to administer Medicaid benefits in many states. Now, in, I would say, about 80% of states, that is how Medicaid benefits are administered. So it's very likely the case in your state. And so then if a provider is a Medicaid certified provider with the state, they still may be only in network with some plans and not others, which is something else to check on. I'm going to come back to that point of fine print in a little bit. But first, I want to give you some clear examples of where to look for information about Medicaid certification of providers on Medicaid websites. So the two examples I've pulled here are from Alabama and Tennessee. The Alabama example is a little more straightforward, though there is a linguistic difference here. So if you go to the Alabama Medicaid website, there is a section of the website dedicated to providers, and within that, there's a page on provider enrollment and forms. So they use the term provider enrollment here instead of certification. And I think the intention there is probably to try and avoid any potential confusion with licensure or certification requirements that professions have at the state level. But at least for my purposes, I think it actually increases confusion to talk about provider enrollment around the same time we talk about whether patients or students are enrolled. So I'm going to continue using the term Medicaid certification, but the point here is just to highlight that some different terms may be used for this in different states. The other example here is from Tennessee, and you may notice this website is not the state's Medicaid website, TennCare's website, but rather it's the website of one of the state's Medicaid managed care organizations, which administers benefits in the state. So in Tennessee, if you go to the TennCare website, that website will direct providers to the Medicaid Managed Care Organization's websites, where there are additional links, forms, etc., for Medicaid certification and joining the provider networks of these insurance companies, these Medicaid Managed Care Organizations. So if you're looking for Medicaid certification forms on the state's website, you may be out of luck and you may need to find them instead on the Medicaid Managed Care Organization's websites. That's not a very common example, but it can happen. And so just wanted to alert you to that possibility if you're looking for information about this in your state. All right, now an important note here, who employs the provider matters. That is, the rules for Medicaid certification may differ for providers who are employed by LEAs or contracted to LEAs versus providers who are community-based. Now, there are some states where regulations prohibit LEA employed or contracted mental health providers from becoming Medicaid certified. I don't have a national repository on that information for you, so I can't tell you the status of every state. But we were able to give an example, to find an example rather, of Colorado in the pre-2020 era. So in this example, imagine Colorado prior to 2020. In that state, school psychologists could not become Medicaid certified. But when Colorado received approval from the federal government for a certain kind of reform called a state plan amendment in 2020, school psychologists could now become Medicaid certified. So that change removed Colorado from the list of states where regulations prohibited LEA-employed school psychologists anyway from becoming Medicaid certified. And there may be other states like that where similar changes may be needed in order to allow school-based providers to become Medicaid certified. Oops, sorry, one more example here. There's another caveat I want to offer, which is that even if a school-based provider becomes Medicaid certified, they may be restricted in terms of the set of services they can render in school settings and still bill Medicaid. These scope of practice related restrictions have been seen in a few states anyway. So for example, in Indiana, it used to be that the Medicaid agency did not allow school psychologists to refer for services or to perform psychology testing services to determine what services might be needed under an IEP for a given student. But following 2021's state plan amendment in that state, school psychologists could now provide those services just in the same way that community-based providers could. So this was kind of an ancillary requirement related to Medicaid certification rules that the state must also allow providers to practice to the full scope of their scope of practice as allowed in other settings. There may be some restrictions in some states on that regard. All right. So as we're talking about the implications of LEA employment of providers versus community-based settings for providers, I wanted to also highlight a Southeast MHTTC resource called A Key Consideration When Staffing School-Based Mental Health Programs, Hire or Partner. So this resource highlights some key ideas that you may want to be thinking about when weighing how to staff your programs. Should you hire or contract, or should you partner with a community-based provider organization? Among the considerations on this topic would be hiring and retention expenses, the administrative burden, and the learning curve you might experience with respect to things like billing and data security, which is certainly relevant to our content today. And then related to that, there's another consideration, which is Medicaid managed care, as I've spoken about previously. So again, in many states, states administer Medicaid benefits through these managed care organizations, and in those states, many community providers will have already done a lot of the legwork associated with managing relationships with managed care organizations, whether it's establishing contracts and doing that on an annual basis, ensuring their in-network status with these different managed care organizations, learning their billing rules and routines or building relationships with them so that they can better understand some prior authorization requirements or other constraints the plan may be imposing. All of these things are required in order to work regularly with Medicaid managed care plans. So if you're an LEA getting into this business, it can be a pretty steep learning curve to get into all of this information and also to engage with these kinds of administrative tasks on an annual basis, which may be required often. Now, I will say that there are some states where this concern gets superseded because the state can require that all LEAs, when they employ providers, are automatically in network for all Medicaid managed care organizations in the state. But to my knowledge, the number of states that have implemented that kind of requirement is relatively small. Tennessee, for example, I think was engaging in conversations related to whether they could implement a requirement like that a few years ago. But I don't know if those conversations continued through the pandemic, so that may not have actually emerged from those conversations. But again, could be another consideration related to the settings where providers work and how they can support your school mental health systems with financing through Medicaid. All right. So I'm going to take a quick break there to invite you all to participate in another poll for us. This is a question that we've been learning more about recently, and I wanted to take the opportunity to ask for your help with this. So if you could, please complete this poll question. We would like to know in your state which group of providers are eligible to bill Medicaid for school-based mental health services, if any. Is it both LEA employed providers and community-based providers can bill for services rendered in schools? Is just LEA providers? Just community-based providers? Neither? Or not sure? And no sweat if this isn't something that you're familiar with at this point in your own learning curve. But yeah, we're interested to learn what information you have at the ready if you are familiar with this, with these requirements in your state. Thank you in advance, Kelly and Josie, for wrapping up the poll once we've reached a quorum. All right, so most folks say I don't know. I totally understand that. And there are some respondents for each of these answers, which is interesting. But of those who do have some sense, their sense is that both LEA employed providers and community-based providers can bill Medicaid in your state. It's great to hear. Where you have neighbors in other states that believe that it's only one LEA or community-based providers that can bill Medicaid, you may have something to share with your neighbors to help them better understand what the gap is from a policy perspective that might be bridged through some kind of reforms that we'll be talking about in a little while. Again, thank you very much for your insight on this. All right. So now we're going to move on to the fourth requirement for seeking Medicaid reimbursement for school mental health services, and that is that the setting where the service is rendered has to be a Medicaid accepted setting. So since we're talking about school-based services, it is required that the school be a Medicaid accepted setting in order to bill Medicaid for that service. All right, so a lot of there's been a lot of action related to this requirement in the school-based mental health services context over the last decade, largely because at the end of 2014, 9 years ago, the Centers for Medicare and Medicaid Services, that is the federal agency that oversees Medicaid nationwide, issued new guidance that said billing Medicaid for services in school settings is now permitted for students without an IEP. So this is the so-called new guidance about the free care rule, which meant something very different prior to 2014 than it does now. The way it works now, if students do not have an IEP, that is most students, students without an individualized education program, which if you're not familiar with it is something that students can get if they are eligible for supports under the Individuals with Disabilities Education Act, or IDEA. If students do not have an IEP, they can receive services in schools and bill Medicaid for them, regardless as to whether they have that IEP or not. Now, I don't want to be confusing to anyone. If a student has an IEP, it has always been that their school-based behavioral and medical services, as specified in an IEP, could be billed to Medicaid. The change in the free care rule guidance doesn't affect them at all. This is just focused on students without an IEP and whether the school or school-based providers can bill Medicaid for services rendered to them. Prior to 2014, the answer was no, and now the answer is yes, conditional on the state implementing this new guidance. But not all states have implemented this new federal guidance under the free care rule. Many have, but not all. The best resource for getting information about this, to my knowledge, is a resource produced by the Healthy Schools campaign, which tracks state actions concerning free care rule implementation for all 50 states and the District of Columbia. I'll be walking you through that resource in a bit more detail in a moment because there are some considerations with it. I do also want to note that different states may need to take different legislative or regulatory actions in order to implement the free care rules updated guidance, which is part of the reason why not all states have taken that action. In states where more extensive actions are needed, some legislators and policymakers have taken it upon themselves to take additional action at the same time. So if you're going to pass legislation related to the free care rule, for example, you might also change rules related to provider certification or eligibility for individual students or covered services. So that might explain some of the differences in the timeline of free care rule implementation across states. But let's take a look at this Healthy Schools campaign resource, which I alluded to a moment ago. The two maps we're seeing on this slide are pulled from the Healthy Schools campaign resource. The link is on the slide here, and I think we're going to include the link in the chat here as well. It's a very neat resource in that it shows for all 50 states and the District of Columbia whether they have expanded Medicaid coverage in schools, that's their term for free care rule implementation, whether the state is in process of expanding Medicaid coverage in schools, or whether the state has not yet taken action. But I need to offer a caveat here. Our focus is on school mental health services, right? And if you look at this map, you might gather, for example, that Georgia has implemented the new free care rule guidance with respect to school mental health services, but in fact, that's actually not true. So Georgia is shaded here because of their expansion of coverage for school nursing services. However, the services of LEA-employed mental health providers are not yet covered by Medicaid in Georgia, and so this map is kind of misleading in that sense. It's focused on any action related to implementation of the free care rule across behavioral health services and physical health services. And so if we're focusing on behavioral health services, this is not a panacea, unfortunately. And yet the information about what actions your state has taken contained in this resource can be a very nice jumping off point for taking further action as needed related to making the school an accepted setting for behavioral health services in your state. So we do want to make this resource accessible to you. The link is useful. Please check it out. I'm going to provide another note about this resource in a few slides. But for now, just know it's a useful resource, just not perfect for our purposes. All right, and I do want to go back and make sure I am clear about the point about students with and without IEPs related to the free care rule. In the context of this fourth requirement, that the school is a Medicaid accepted setting in order to bill Medicaid for school-based services, this requirement applies differently for Medicaid enrolled youth with an IEP versus youth without. School-based services in an IEP, for students with an IEP, will always be covered, again, provided the other requirements are met, that is, the provider is Medicaid certified, that the client or student is a Medicaid enrollee, and so forth. However, in states, and that's true regardless of states' free care rule implementation status, it's true where you are. Now, in states that have not yet implemented the free care rule for mental health services, however, Medicaid cannot be billed for services that are provided in schools for youth without an IEP. Simple as that. All right. So I want to take this moment to pause and acknowledge that some folks might feel a little bit overwhelmed by the information I've been sharing over the last several slides. I think the school accepted setting piece and the free care rule are particularly nuanced and difficult for people who are just coming to this fresh. And so I wanted to highlight another resource we put together that provides an overview of Medicaid and a fairly simple introduction to how Medicaid can work to finance school mental health services. This was a webinar we gave last year called Medicaid and School Mental Health 101. So if that feels like the kind of webinar that might be more useful to you than what we've been doing so far today and in part one of this webinar series, I would encourage you to check it out. It again is a free resource. You can download the slides, view the recording. It's all available through the Southeast MHTTC website. So check that link in the chat. I also want to recognize that we are at the halfway mark of our hour. And so now might be a good time for you to think about what questions you want to ask in the Q&A portion of our hour today. And so if those questions have already come to you, please feel free to enter them into the chat and we'll do our best to cover them during the Q&A portion. You can also save them and enter them in the Q&A portion later. That's up to you. All right, but I'm now going to pivot to talk about a few different types of Medicaid reforms that might be useful, in particular for addressing this fourth requirement that the school be a Medicaid accepted setting. And illustrate how different states have been implementing the free care rule using these different types of Medicaid reforms. All right. Another thing you can enter into the chat. This is not the same kind of poll question. We won't be pulling up a Zoom poll for this, but if you're aware of any changes that are being made in your state related to any of the 4 requirements that I've been talking about across this webinar series, or maybe that may be underway in your state, it'd be great if you could add them to the chat and enrich everyone's understanding of what's going on in your state related to the financing of school mental health. So again, just enter your information, if you have it, into the chat. Okay, but we're pivoting to talk about reforms. And this is a moment where I'm going to direct your attention again to our Medicaid FAQs report, which I alluded to previously. There's a section in that report, the 10th section, that talks about major types of Medicaid reforms and how they might be useful for expanding comprehensive school mental health systems in your state. So the section talks about legislation, regulatory changes, state plan amendments, and Medicaid waivers, all 4 of the major types of potentially relevant Medicaid reforms, and gives examples, again, related to the free care rule. So if you're the kind of person who likes to see this kind of information written down, see section 10 of the FAQs report. I highly recommend that for you. All right, so in general, different types of Medicaid reforms may be needed in order to better support financing of school mental health programs in your state. The actions can be taken by state legislators or Medicaid agency leaders with guidance from the state Medicaid agency or local education agency authorities advocating, but they ultimately need to take the action to pass legislation or make regulatory changes. It may also be necessary that they obtain approval from the federal government for other types of Medicaid reforms, including state plan amendments or Medicaid waivers. But in some states, in fact, some combination of these strategies may be needed to implement a given reform and advance comprehensive school mental health programs in your state. And part of the reason for that is that there are different levels of legal authority in a state that each of these pertain to. So just to clarify and get everyone on the same page with this, the state constitution is the highest legal authority in any state. Nothing can violate it, including new laws or codes that are passed by the state legislature. These are called statutes. Statutes cannot violate the state constitution, but they are still quite a high legal authority in the state. And in particular, they can determine which kinds of regulations can be implemented. So state agencies may implement state regulations and they supplement what is written in state statutes and write out in more detail how some of these things can actually work in practice. But they cannot be written, these regulations cannot be written in ways that violate the state constitution or state statutes. So it may be necessary in some states If you want to make a regulatory change, it may be necessary to make some legislative changes first in order to ensure that the regulations can actually be written the way you want them to. So in particular, by passing legislation, states may remove existing restrictions on possible reforms, or they can grant the Medicaid office or other state agencies the authority to implement reforms because of that hierarchy of laws. This turned out to be relevant in California and their implementation of the free care rule back in 2015. So in 2015, the state passed a law that removed restrictions prohibiting LEAs from billing Medicaid for targeted case management for children without an IEP. So for this particular example of targeted case management services for children without an IEP, it was necessary to take legislative action to remove existing restrictions that prohibited LEAs from billing Medicaid for these services in this context. There's the state bill listed on the slide here. I want to add too that after this legislation was passed, that wasn't the end of the story in California. After the legislation was passed, rule changes had to be written within the Medicaid program that then would allow LEAs to bill Medicaid for school-based targeted case management services regardless of IEP status. That was the way the rules were later written, and they couldn't have been written that way if it hadn't been for the legislative changes first. So that's a good example of the kind of sequential legislative and regulatory action that may be needed in some states in order to relax, perhaps, existing restrictions on the school as a Medicaid accepted setting for certain services. All right, so here's another type of reform that is very common in advancing the cause of comprehensive school mental health systems and programs. This is the State Plan Amendment, or SPA. Yeah, SPA pronounced just like a jacuzzi. So the state plan is important to understand if you're going to talk about amendments. The state plan is a state-federal agreement about how the state will administer its Medicaid program. The federal government pitches in a lot of money for the Medicaid program, and so states have to abide by federal requirements and by the terms of their contract with the state plan, in order for everyone to agree that the program is being run appropriately. But that state plan might need to be amended over time, and that's why these state plan amendments can come in handy. So when a state seeks approval for a SPA, they may be aiming to change a lot of different things that are relevant for school mental health systems, like rules for determining Medicaid eligibility or what services are covered. They also can affect reimbursement rules, like the setting where certain services can be provided and still be Medicaid eligible, or what is paid for a given service. All of these things can be changed through SPAs to great effect. So for example, in 2017, Massachusetts received approval for a state plan amendment that allowed schools to bill Medicaid for services that previously could not be billed when provided in a school setting. The list of services included in the state plan amendment included things like physician services and respiratory services, some of which can be really relevant for school mental health programs. But the state plan amendment was just specific to those services that were previously not allowed to be billed when provided in schools. Another more recent example comes from Virginia. This was just within the last few months, and it's a really expansive example relevant to this fourth requirement that the school is a Medicaid accepted setting and the free care rule. So Virginia's state plan amendment allows schools to bill for all Medicaid covered services regardless of whether the services were listed in a student IEP or not. So to my knowledge, this is among the most expansive state plan amendments that really opens the door for billing Medicaid for a lot of services when rendered in schools, including pretty much anything you could think of related to comprehensive school mental health services, at least of the tier 2 and tier 3 variety, if those terms mean something to you. If you're looking for information about state plan amendments in your state, you can check out Medicaid.gov and their Medicaid state plan amendment repository. It's a pretty searchable and user-friendly database, I've found. All right. So we've talked about legislation and regulation, and we've talked about state plan amendments. I also want to mention Medicaid waivers, which is sometimes another vehicle for reforming Medicaid in ways that can advance school mental health systems. State plan amendments can only be made in ways that still adhere to federal requirements for Medicaid programs. Medicaid waivers, however, if you get approval for them from the federal government, can allow the programs to deviate from existing federal requirements and explore more innovative program designs than the original Medicaid rules were slated to allow. So you can do some interesting things with Medicaid waivers that you can't do with state plan amendments, including under Medicaid managed care, for example. That's a very common type of Medicaid waiver. Now, it's not easy necessarily to get a Medicaid waiver, though. There are different requirements here than for state plan amendments. For example, you cannot implement via Medicaid waiver something that increases costs to the Medicaid program or to the federal government. That is the so-called cost neutrality requirement that Medicaid waiver applications have to meet. So another type of Medicaid reform, you can do some really innovative things with it, but may be less commonly used to support advancements in school mental health programs than state plan amendments. All right, so I also want to illustrate that in order to implement the free care rule and help schools and school-based providers meet the fourth requirement that we're talking about here today, it may be necessary for states to implement one Medicaid reform, multiple reforms, or in some cases, none. So Florida is a good example where multiple different reforms were needed in order to advance the free care rule and its implementation in the state. So in 2017, the state received a state plan amendment approval, which removed reimbursement restrictions on school-based services for students without an IEP. And then in 2018, they passed legislation, which would then take effect in 2020, removing similar statutory restrictions. So in the state, there were actually regulatory and statutory restrictions prohibiting the provision of school-based services for students without an IEP. And it took 5 years to get all of these things on the books, reformed as needed in order to implement the free care rule. So that was a complicated example. South Carolina's example is a bit more straightforward. So in South Carolina, prior to the free care rule's new guidance in 2014, the state plan and its regulations had no restrictions related to the school setting. And so once the new free care rule guidance came out, LEAs could freely implement the free care rule guidance and building practices themselves without any SPA or legislative action. So that was pretty straightforward in South Carolina, actually. So there is a real wide range of the different types of reforms needed in order to implement the free care rule and how much effort it might require in any given state in order to make it happen. All right, so I do want to come back to the Healthy Schools Campaign resource one more time and highlight for you its utility because it contains a lot of information on free care rule implementation in your state related to covered services, child eligibility, billing providers, nursing services, and behavioral health services. And yet, some of their notes referring to the state's status and its implementation of the free care rule that may not represent what's going on in the state for behavioral health services. So again, the caveat with this resource is that it is broad. It concerns free care rule implementation at a high level and does not focus on behavioral health services implementation. So it may not be the perfect panacea resource for you. Still, it's really useful. We definitely encourage you to check it out. There are a number of other resources that I would point you to that we have prepared here at the Southeast MHTTC and the School Mental Health Initiative. And so to keep track of all of these resources, we've prepared a resource catalog that we update regularly. And so I would encourage you to check out our School Mental Health Resource Catalog. I believe we've included the link in the chat now. It's a pretty searchable, organized document that captures information on the whereabouts of all of our different resources and its content. So please do check that out. And come back to our website regularly if you'd like to see the latest and greatest resources coming from our School Mental Health Initiative, related to financing or otherwise. I did want to point to a specific resource listed in that catalog. If you're looking for more information about state plan amendments and Medicaid waivers, we put together a short report focusing on these two types of reforms and gave examples of how states have used them to expand coverage of school mental health services in their Medicaid programs. You can check out that link. It's in the School Mental Health Resource Catalog, as well as on our website. And then there's and I believe there's a link in the chat now also. And I would also highlight there are a number of other relevant resources you might find useful for your purposes. I mentioned the School Mental Health 101 webinar previously. Again, the link here is here in the slides if you download them. We also conducted a webinar a few years ago focused on the financing of school-based mental health services, specifically in the context of Medicaid managed care. So if that part of my discussion today seems particularly relevant to your context, that might be a webinar you'd want to check out for some more in-depth conversation about Medicaid managed care and its relevance to school mental health programs and settings. We also have an infographic about financing school-based mental health services through Medicaid when you focus just on administrative expenses. I talked about this some during part 1 of our webinar series, but in some cases, Medicaid can pay for administrative expenses like outreach expenses when trying to identify who may be eligible for Medicaid benefits. The rules about how to do that are covered to some extent in this infographic highlighted here, and in some other resources that infographic points to. And then lastly, if you're a real glutton for Medicaid-focused resources in the school mental health context, I might direct your attention to a webinar we led last year that guides you through the many different resources that our center has put together related to Medicaid and school mental health financing. It orients the attendee to nearly 20 resources on the topic. And so there's no better place to go than that if you'd like to be oriented to the finance-related resources you see in our school mental health resource catalog. All right. So now we're going to enter the Q&A portion of our conversation. Now would be a great time to enter your questions into the chat. If you haven't already done so, I'll be looking there for your questions if you'd like to ask me about any of the content here today or related issues in your state. I do also want to highlight for you that if you're still with us and have not yet clicked the link to evaluate our webinar today, please do so. It is in the chat now. Click the GIPRA link and complete the form. It really helps us with our funder, so we really appreciate your feedback and thoughts there. And then don't forget, if you complete that survey, a second one will automatically pop up for you, which gives us at the center more information about what you liked and didn't about the webinar today, and what information and what may be useful in terms of producing webinars and future resources here at the Southeast MHTTC. Kelly, would you like to add anything about the GIPRA link before we dig into Q&A?
No, I think that's all. It's there in the chat, ready for folks.
Okay, great. All right, so I'm looking for your questions in the chat. I'm happy to answer anything you've got there. And if there have been any questions added in the chat previously, I'll start scanning for those as well. Thank you, Fran, and thank you, Bobby. I see you've added some information in the chat about recent policy developments in Oregon and Delaware related to the school mental health, related to the free care rule and implementation of school mental health programs there. That's great. I'll be glad to learn more about what's been going on there. And otherwise, certainly glad if many of you have transitioned to starting to provide feedback on our webinar series via the GIPRA link and the subsequent Qualtrics survey. But again, I'll be available for the next 10 minutes or so to answer any questions you have. I see one that's just come into the chat from Michael. Thank you, Michael. Can you speak to strategies for use of Medicaid funds in early education and care settings? I am aware of progress made in Michigan and Colorado. Any others? All right, so when we're talking about early education and care settings, I think we're probably talking about kindergarten and pre-K settings. So Medicaid has different eligibility rules often for individuals who are age 5 or under versus individuals who are, still students, but they're age 6 through 18. Often Medicaid is more generous in its coverage opportunities for youth in those younger age ranges. We talked a bit about terms of Medicaid eligibility and enrollment in part 1 of this webinar series, so there might be some more information in that part of the webinar series to check out if that's something that's of interest to you. Am I aware of any strategies for using Medicaid funds in these settings? Well, my understanding is that in some states, there are distinct regulations in place governing different types of educational settings and whether providers can bill for services they deliver in those settings versus others. That has not been a point of focus in our center's research and resource development to date, but it is certainly something we can look into more. I see you're pointing also to the fact that these states have obtained coverage as an EPSDT service. So this is also something we talked about in part 1 of the webinar series in some depth. For those of you who are not familiar, EPSDT is the acronym for the Early and Periodic Screening, Diagnostic, and Testing Benefit, which I've just added into the chat. EPSDT is a mouthful, but it's also a really important and generous Medicaid benefit that all state Medicaid programs have to have in place. Basically, it is a requirement that all states cover a wide range of screening and diagnostic testing services under the Medicaid benefit for anyone who's a Medicaid beneficiary under age 21. And this is the kicker with EPSDT, if a service is identified as being needed through an EPSDT covered screening, then that service that is needed will automatically be covered by Medicaid, even if that service isn't listed on the list of Medicaid covered services in that state. EPSDT trumps whatever that list says. And so if there was an expansion in these states of what was considered an EPSDT covered service, particularly for younger youth in pre-K or kindergarten settings, then that's great. Then that probably means that's a pretty significant expansion of the type of services that can be billed to Medicaid in support of those students' mental health or other needs. Michael, you're adding a bit more detail in the chat. It funds a service called Infant and Early Childhood Mental Health Consultation in Child Care Settings. Oh, that's great. So we're not even talking about schools necessarily. We're talking potentially about daycare settings as well. That is something that we have not paid a lot of attention to as one of our primary foci here at the School Mental Health Initiative, given how much work there remains to be done, as you've seen in today's webinar, related to expanding implementation of the free care rule in school settings. But I'm very glad that you brought this to our attention. It's something we will definitely pay more attention to going forward. I look forward to learning more about that. Thank you, Michael. All right. Are there any other questions that folks have? I'd be happy to answer them with the few minutes we have remaining before we need to wrap up. And if not, Kelly, I might turn it over to you again to remind folks about the importance of helping us with evaluating today's webinar.
Yes, we've put that link in the chat one more time. And if anyone has any questions, I will definitely be on just past 1 p.m.
Thank you all very much for joining us today. Again, we really appreciate your feedback. And don't forget, if you'd like a certificate for participating in today's webinar, you can get one by completing these feedback surveys. Thank you.